This is Teeth in a Day. Today I'm going to explain what Teeth in a Day procedure is and all the different parts and pieces of how we do it. Hey guys, what's up? I'm Dr. Sean Moriarty at More Smiles. We opened back in 2013, and since then we've been doing general dentistry procedures. We started really focusing on doing the Smiles in a Day or Teeth in a Day. The Smiles in a Day procedure is exactly what it is. So you're getting teeth within a 24-hour period. So today we're going to talk about basically what the Teeth in a Day procedure is, who's a good candidate for it, kind of like the process from start to finish, and then also what to expect and the long-term benefits of it. So what is Teeth in a Day procedure? So the Teeth in a Day procedure is where someone they have really badly failing or missing teeth. So somebody that has a full upper, lower denture or both, or they need one of their arches restored. It could be the top arch, it could be the bottom, or it could be both. Typically the people that I see are either people that have dentures that they don't fit very well, they're falling out of their mouth, they're not happy with, so they're not stabilized, so they're not able to kind of like chew food properly and eat and smile and function with them. And I would say probably the majority of the people that I tend to see are people who have a full mouth of just failing, broken teeth, missing teeth, decayed teeth, infections. Maybe some of the teeth broke off and there's root tips in there. And, they're really at a point where it's like a hopeless prognosis for the teeth. There's no repairing them. Sometimes, and I'll just mention this, sometimes when people are not happy with their smile, someone comes in and they say, rip them all out, take them out. I don't want to, I don't want to do this anymore. I just want to get the full mouth implants. And I actually end up talking them out of it because, as it turns out, it's actually better to save your teeth. So if we can buy you time, if we can buy you another 5, 10, 15 years, even if it's something that's not maybe going to last forever, it's going to be a lot better to try to save the teeth. And, we have to take into consideration the pros and the cons. We'll kind of get into that a little bit later on, but it's really something that, it has to be the right procedure for you, meaning that, there's no other way to repair the teeth, or it's too far involved where, it may be, $50,000 to repair the mouth, or $60,000 or more to repair the mouth, and someone just doesn't have the wherewithal to do that. So that's kind of what it is. That's kind of the overview of what it is. And I'll tell you what is all on Teeth in a Day procedure. So the procedure in and of itself is where someone comes in. We'll talk about the appointments in a little bit, but basically they would come in for the surgery. We extract all the remaining teeth. We kind of level and profile the bone, so make everything even, and then we'll place about 4 to 6 implants per arch. And then once the implants are in the bone, then we'll actually attach teeth on top of it, or we'll take impressions for those teeth. A lot of times people, it's very embarrassing for them to go to the dentist, or they've had a traumatic experience. That happens quite often. And really for not going to the dentist and a lack of care, they have had all these things happen to the teeth and they're kind of beyond repair. So that's kind of like who's a good candidate for it. It is important to have good bone structure, and also there's general health considerations as well. When someone comes in, we need to do a thorough medical history and evaluation. We do ask a lot of questions. We need to know, how did you get to this point? What are the conditions that kind of caused you to come here? Sometimes it's, general health considerations and systemic diseases like diabetes. Sometimes people have been on medications that dry their mouth out. Sometimes, like I said, there's some past drug use. Sometimes they don't have healthy enamel and they've had a lot of cavities throughout their life, and instead of going to the dentist and the dentist fixing things, they just take teeth out, which is, unfortunately it happens, right? And that's okay, but you get to the point where you need to do something about it. So let's talk a little bit about what to expect and how that kind of process is. So basically what happens is someone would come in and they would, come in for evaluation. What we'll do is there is a lot of things that we need to ask. There's a lot of questions that we need to kind of talk about and have answered, as far as like, how did you get here? How is this affecting you? Is it affecting you functionally? Are you not able to chew and eat your food? Are you having choking sensations? A lot of people also have issues with, they're embarrassed. A lot of people tell me that they don't really go out of the house too much. They don't go out in like social situations where they have to talk to people. A lot of people that are speaking in public facing are quite frankly embarrassed by this, right? And they haven't been to the dentist for a while, they're in pain, they can't chew their food, so functionally they're having issues. There is a very profound psychological effect when someone, when you smile and they have either missing teeth, especially in the front, or black spots, or like a combination of those things. Maybe they have periodontal disease and the breath kind of smells. And so this is like a really big deal. And, for us and for me in particular, I love to see this transformation process. I'm very passionate about it because, I started my career in general dentistry, moved to, the prosthetic part of it, did a lot of full mouth rehabilitation, and then kind of went into surgery more. And it's really combining all those things, and it's really a way for me to be able to, do something that's life-changing for someone. I can tell you that a lot of people, when we give them their new set of teeth, even the temporary teeth, it's very emotional. And it's life-changing for people. Back to the original kind of process. So come in, fill out the medical history, have a conversation. After we do that, we're gonna get a CAT scan. That's a three-dimensional x-ray. That's what's right here. And then what happens after that is we'll put those pieces together. We'll do an intraoral exam. We'll do an extraoral exam of the head and neck. And once we have all that information, then we can kind of talk about a plan. If the plan is to save the teeth, then typically we'll refer to a general dentist, or we have in-house services here with other restorative dentists. But if it is something that's an all-in-X surgery, at that point we definitely need to kind of talk about the process and the overview. Once a person is on board and they're kind of ready to go, then we would bring them back for a second appointment, which is a records appointment. During that appointment, we might get another CAT scan depending on the angles and kind of what we see in the first one. But typically we need to make sure that we have the records, we have the CAT scan. And what we're doing with this information is we're trying to take all the pieces from the x-ray and the smile and some video, and and then we'll take an intraoral scan, which is kind of like a digital impression. We put all these pieces together and we plan the case. So second visit is the records visit, and then the third visit is the big day. It's the surgery. So someone comes in. Typically we'll do this early in the morning, and what we'll do is we'll seat the patient, and then what happens is I'll come in and do the surgery. So teeth come out. We profile the bone, we kind of flatten it and make sure everything's at the same level. We'll place the implants. Usually it's about 4 to 6 per arch. So if we're doing a double arch, we'll do 4 to 6 on the bottom, 4 to 6 on top. And then we put the connectors on the implants individually. And then once the connectors are on, there's actually a little piece that goes on top of it. It's called a scan body, but basically what we're doing is once the implants have been placed, we need to transfer the information to the laboratory of where those implants are. So each of the little scan bodies will go on each of the implants. Say if there's 6 of them, they're about this big. There's a little, it almost looks like a QR code that's on them. And then we have a special camera, which is it's called a photogrammetry camera. And what this camera does is it actually captures the position in a 3-dimensional space. And then once we do both arches, so we'll do the bottom and then we'll do the top, we put these little round metal healing caps on top of it, it sits a couple millimeters above the gum line. And then that information will be taken and sent to the laboratory. They'll design the case in about 30 minutes, and then they'll actually send it to the 3D printer, which is in the other room. And the 3D printer prints teeth exactly like this in a matter of about 30 or 40 minutes. So this tooth color is fully customizable. The teeth are fully customizable. So like I said, every case is the same, but it's different, meaning that everyone's teeth, if it's a male or a female, depending on how much lip mobility they have, how much their lip goes up or down, all this stuff is fully customized. And then what happens is we will design the teeth and get a rendition, and then that information gets sent. We 3D print the teeth. They'll either come back later that day, or most times they'll come back the next day. And then all the teeth, when this thing comes out, it's white. If you guys can see that, there's gum tissue, so that actually gets stained and painted on there. So depending on the pigmentation in the person's skin and in their mouth, we can actually custom shade match the teeth and the gums to that, which is super cool. Anyway, so they would come back later that day or even the next day, and then what happens is we'll put this in, and then as you can see, there's the holes in the teeth, and then that's what'll happen. This would get placed into their mouth. There's little tiny screws that go in there. We put one in the top, we put one in the bottom. We'll have the patient bite together, make sure the bite's okay. Oftentimes there's minor adjustment that needs to be made. Sometimes there's major adjustments, but this gives us a really good idea and rendition of like where the teeth were planned to be based on their old smile, based on their old bite. If they have a good bite, we'll utilize that. If they don't have a good bite, there might be an extra step that we need to kind of fit a pair of teeth in there and 3D print something in there prior to, which is kind of analogous to a pair of dentures that we would use to get their vertical dimension, which is basically when the teeth come together. Same day, next day, you get a brand new set of teeth. And I can tell you that the vast majority of the time people wake up, they're happy, they can't believe it, they're elated, sometimes they're crying, sometimes I'm crying, everybody's crying. It's very emotional. And then basically you get to have these teeth temporarily, and you'll wear them for anywhere from about 4 months to 6 months. Now, if we need to change anything with the teeth, as far as the shade, as far as the color, the size, if the bite is, if the cant is like a little bit off, if it's a little off angle, we'll do that. Usually for the first month, they're on a softer liquid diet, which usually, people complain about a little bit, but it's one of those things where we have to make sure everything's working how we want it to. And then we just kind of send them out into the world with the teeth and let them chew with the teeth, see how they look, see how they're smiling. A lot of people hide their smile and they're laughing and they're kind of covering because they're embarrassed, and now actually have to learn to smile again. I did forget to mention post-operatively, this sounds like it's a really painful thing. It's not. It's actually something that is, usually by the third day, I would say 50% of people or more not really sore at all, or maybe they're a little bit sore. And then the people that do remain sore after day 3, typically by the 7th day, and after about a week, they're good, which is kind of crazy when you see the procedure from my standpoint. But the mouth is very well innervated with blood vessels. It heals really well. So, this is something that, people can tolerate very well. Typically, you have to be down for 2 days. So the first day is going to be the day of surgery, and then you're going to go home and kind of sleep and relax. And then the next day, typically, when people come back for the teeth, typically you would want to give yourself probably 1 extra day. So downtime typically is only 2 days, which is good. And that's it. And then long-term considerations wise, this is something I typically tell people it's going to take 9 months to a year. Oftentimes it doesn't take that long. We do temporary teeth in a day. I know there's some companies and some people out there that they'll take impressions and they'll give you the permanent teeth. That's a big no-no, because what happens is a lot of times people have to you think about this, if you get 2 new knees, and you have to get used to them a little bit. It's the functioning, it's how they feel, it's how they work, it's exercising again. You're not going to get 2 new knees and then a week later go and run a marathon, for example. That doesn't make any sense. So, really it's the important part to give someone temporary teeth, and then that way you can kind of try it before you buy it, meaning you're happy with how they look, you're happy with how they feel, how they function. Oftentimes people, when they have bad teeth too, they're not able to articulate their words, their speech is off a little bit, sometimes they lisp, and sometimes with the temporary teeth, after they get them, they'll also have a lisp, or they'll also have to kind of retrain your tongue to getting used to the new teeth, which is normal, which can take 4 to 6 weeks or even longer sometimes. So that's something that's really important. So it is, when we're doing the post-operative visits, 1 day, 1 week, 1 month, 3 months, we're making sure that the implants are integrated, they're healing, they're fusing to the bone, the temporary teeth are working how they're supposed to, you're happy with how they look, you're happy with how they feel, you're happy with how they function. And then after that point, once we're in a good position and everything is ready to go, after about 3 to 4 months, then we can go to the permanent ones, okay? And the permanent ones are a little bit different. Typically we make something like this, which is zirconia. This is like a medical grade porcelain. Same thing, it's got the holes. As you can see, it's very similar, but this one, the gums are a little bit darker, but this does not stain. So if someone smokes, if they drink coffee, if they drink red wine, this is something that is gonna last, if you take care of it, this can last forever, okay? Now, I do like to mention that, although this is a permanent solution, you have to take care of these teeth, so you're still going to be brushing the teeth, you're still going to be using a water pick, so you're going to be cleaning them kind of like your regular teeth, but you're going to be cleaning them a little bit differently. And then you do have to go to the dentist, ideally every 3 months. I know it sounds like a lot. People, usually go every 6 months, but ideally every 3 to 4 months. And I would say you should go at least every 4 months. One time you would go in and they would just kind of clean around the gums and the teeth, and then the next time they would take this out. You take the screws out of here, this comes out, you can put this in an ultrasonic cleaner, clean anything off that's on here, and then put it back in the mouth. So one time clean it with it in, one time clean it with it out. And that's basically it. So maintenance is like anything else, you know, you have to maintain it, you have to clean it, you have to take care of it on a regular basis. The issues that I see with people and implants failing are usually people that have diabetes that is uncontrolled. So their A1C is over 8 for like a long period of time, or they're not properly doing their hygiene, or they're not properly taking care of the teeth, or they're smoking. Smoking is obviously bad for your health. I don't like to lecture people about it, but it's not contraindicated when you do implants. But I will say that people that smoke typically have a lot more complications than people that don't smoke. Complication-wise, sometimes you can have issues where implants don't integrate. What happens in that case? We would go in, we would take it out. If we have 6 implants, maybe we try to graft the area, let it heal for 4 to 6 months, and then we can go back in and try to replace it. Sometimes we can take it out and we can put it, maybe a little bit further back, a little bit further forward if there's good bone in that area. And sometimes we just have to call it and say, you know what, we're not going to put another implant in here, take it out, but as long as we have a minimum of 4, we can do the prosthetics that screw down. Every case, like I said, is fully customizable, so it's something that we want to make sure that we're listening to. Who is the patient? What do they want? What's the ideal outcome? And then, we do the screening and we get it done for you. So anyway, if you want more information about this, check out our website, More Smiles or moredentalimplants.com. This procedure is really life-changing for anyone out there that is scared, that has had their teeth break or fracture, infections, and really the mouth is not repairable. Just know that you can have a new smile, you can have your smile back, and you don't have to walk around being embarrassed. There's a lot of people out there that have the same issue. So I would say definitely not to feel a certain way about this. A lot of people, we're very hard on ourselves when we judge ourselves, and come talk to us. We also work with medical insurance. So I've seen people that have had, $60,000, $80,000 treatment plans, and they get this stuff for pennies on the dollar. I've seen it, medical insurance completely cover this. It's not a cosmetic procedure. If it is medically necessary and you do have the right medical insurance and they cover it and you have that benefit, I've seen it get covered. That's another thing too that's definitely worth mentioning. So anyway, that's all I got for today, guys. Thank you, love you, see ya, bye.